we will move on right on time on our panel discussion. And we are very pleased that and very fortunate to have very distinguished practicing physicians who have made a change in their own practice. And they will be sharing with us their own experience in their practice, how practical integrative thinking is uh, in chronic disease management, in health promotion and illness prevention. And as a context, I would set that uh, even though we have tremendous capacity of technology, but post-COVID, each one of us are hearing that system is not working. System has fragmentation. Burnout is happening. And especially in chronic diseases, I think this is a great opportunity for us to build innovation in our own system on the basis of integrative thinking. Over next hour, I hope it'll give you much deeper understanding of what we are talking about and how science can be incorporated in our own system. So, not in any particular order. I'll just start with we have Dr. Jasdeep Saluja, Dr. Brenden Byrne, Dr. Bal Pawa, Dr. Ramneek Dosanjh, Dr. Anurag Saxena, and Dr. Hanna Nette, who have joined us. And I'll start with Dr. Jasdeep Saluja. The format is I'll introduce them. They will share for 5 minutes their personal perspective. And then after each one of them, we'll have time for some discussion. And then Dr. Ganguly will bring a summary. So Dr. Saluja is an internist, practicing internist who was practicing as a traditional Western medicine and then made a big change and started a clinic called Arogya in Victoria, which has been very successful. And he will share how that change has improved healthcare he delivers. So, Dr. Saluja, over to you.
Thank you, Dr. Garg, for the introduction. Good morning, everybody. Thank you for having me here today to just on this panel. My name is Jasdeep Saluja. I'm an internal medicine doc working and living in Victoria, BC. So I guess I'm going to start with my sort of journey to, finding lifestyle medicine and how we came to be practicing this way. I was traditionally trained. I was trained at UBC for my internal medicine residency. In my last year of residency, my dad actually ended up at the age of 58 in hospital with a stroke. And he was taken care of exceptionally well. He had the best of treatments. And he did really well throughout the stroke, throughout that episode. And he was started on all the guideline-directed medical therapy. And he was doing well, and nobody spoke to him about anything about his lifestyle, right? No one talked about the role of activity or sleep or diet, any of that. And I didn't know any better either. So we continued living life. And 4 years later, I was driving him to the hospital with this heart attack. And again, he was taken care of exceptionally well at the hospital. And he came through that episode quite well. And it was at that time, started thinking a little bit, saying that, we really haven't changed the medications after the stroke and then after the heart attack. The medications really remained the same, other than, the addition of one antiplatelet agent, and started wondering, is this really what's going to work for him? And, are we missing things? And so I started looking at the literature, and I was actually pretty surprised to learn that there's a lot of literature out there that supports the idea that what we eat could make a big difference in, our health outcomes, not only just on the preventative side, but the management side. How we sleep, how we act, our activity levels, our stress, and, our love and support systems around us, they can make a big difference. And so we started making, just as a family, my mom, myself, all of us started making changes in our own health, in our daily activities. And we started noticing that we were all improving in our health outcomes. For myself, I was able to cut my cholesterol in half, lost a lot of weight, had an increase in energy. And eventually I started thinking, well, if this is good for me and my family, this is probably something that I should be sharing with patients, especially since there's evidence with it. And at the time, I had moved to Victoria from Toronto, and I was working in the hospital, and I was in the hospital internal medicine clinic. And when I was getting consultations there, I would start talking to patients about, what are you eating, and what's going on in life. And you start having people opening up about their personal lives and kind of seeing the connection, trying to get them to see a connection of, that those everyday life moments and, what their cholesterol level is like, or what their A1C is. And I started getting people, taking me up on offers to help them change that. And half the time people would start making these changes. And lo and behold, one of my colleagues, the guy, the physician that actually had hired me out to Victoria, was head of internal medicine, Dr. Jasdeep Saluja, was going through a similar type of journey in his health and his approach to, medicine. And so one day, about 6 months, after I had started making my changes, we sat down for having lunch and we started sharing about, our approaches. And we were actually quite surprised to see that we were both on that same journey. And so we started talking about, how about if we had a system where it wasn't just physicians, prescribing, yet again, lifestyle changes, as opposed to just metformin, but having a system where we had, health coaches, registered dietitians, clinical counselors, someone to teach meditation, yoga, and kind of really create that support network around patients. And initially we thought we'd do it through the hospital, and we decided maybe we should just go out and try it. And so we teamed up with one of our other co-founders, and that was back in 2017. Over the last 5 years, it's been a great learning experience. It's funny, I started working with patients, talking about diet a lot, because that's what I had studied and had researched. And now in 2022, I think I start off with more with, why are we here? Why are you comfortable, with your current illness? Why might you not be comfortable with your current illness? And, trying to get to what their core motivations are in life, and trying to really find out more about that. And I find out that upstream sort of, pillar, in lifestyle medicine, we talk about 6 pillars. We talk about physical activity, diet, sleep, substance use, stress reduction, love and support. But I think we're also learning about this upstream pillar of, having meaning in your life, right? Having that type of, what's your why, and why you wake up every day. And so, I would, Dr. Garg is kind, and he says that we've accomplished a lot, but I say that we've learned a lot, and we're continuing to learn. And it's a pleasure to be here with all of you.
Thank you very much for that introductory remarks, Dr. Saluja, and hopefully Chatline will share some more comments. At this time, I'd like to introduce my friend and a colleague, Dr. Brenden Byrne. Dr. Byrne is a general practitioner, but he is really a technology giant. He started the first medical records program with the TALUS, and now has opted to build his own private practice as a general practitioner in city of White Rock under Wellness Garage. And he will be sharing his personal thoughts for next 5 minutes. Brenden, over to you.
Hi, everyone. Thanks, Dr. Garg, for introducing me. So I'm Brenden Byrne. I'm a lifestyle medicine doctor speaking to you from the unceded territory of the Semiahmoo people, otherwise known as White Rock. Pose a question to you. If you saw cars driving off a cliff, what would you do? In our world today, chronic lifestyle diseases cause the overwhelming majority of morbidity and mortality. So people are getting sick and dying from chronic lifestyle diseases like diabetes, heart disease, stroke, neurodegenerative disease, osteoarthritis, and even a significant portion of cancer is really lifestyle and oriented. Since 2011, more people, suffer from obesity than from hunger in our world. And treating these diseases without treating lifestyle makes no sense. It's like we're watching these cars drive off the cliff and we put an ambulance at the bottom. Actually, worse than that, we've put our whole healthcare system at the bottom of the cliff. So, I really kind of have come to this realization in the last number of years that we need to climb the cliff, and we need to put a barrier up top, and we need to help people change lifestyle behaviors. Now, often that's met with, but changing lifestyle behaviors is really, really hard. And that's why it's a cliff. We've got to climb the cliff, right? It's not going to be easy, but if we don't try, we're not going to get there. And in fact, every clinical practice guideline that there is for chronic diseases starts with lifestyle changes. And a little bit like, Jazz's intro, it often starts with nutrition and some exercise. But as you start to practice this, you start to realize that the other pillars are as important and, in fact, probably more foundational. So nutrition, exercise, clearly two pillars that we've got to face. Stress tolerance, absolutely important. Sleep, relationships, and then purpose, that meaning. What is the person's meaning? The challenge, though, in our system is our physicians don't have the time or the training to deliver this type of coaching, right? It's not, we're not set up to do this properly. And one of the things that, one of the silver linings for COVID in our practice was we started to have to use digital technologies to deliver some of these cares, some of this type of approach. And what we realized was we weren't leveraging, we had this phenomenal digital relationship. We could see people online like this. We could actually see multiple people. We could see groups like this. We could use video. We could use text. We could use audio. We could use infographics. And it started to come to me that this might help us climb the cliff if we actually put together a full stack solution, meeting people where they are in their homes, in their lives, on their devices, and help them actually start to make these changes. So we've started a new company from our clinic called Lifestyle RX. So Lifestyle RX, Lifestyle Prescription. And really our goal, we're starting with type 2 diabetes, but our goal is that every type 2 diabetic has a lifestyle prescription, not for glycemic control, but actually for diabetes reversal, right? We want to shift the paradigm away from just controlling and managing these diseases because they can be prevented and they can be reversed if you take this holistic approach. And so this full stack virtual care is, there's a technology piece to it. It's synchronous, so we can have conversations like this. We can have asynchronous, where people can take the time to learn and watch video, audio. We've got one-on-one care, we've got group care, and we've got team-based care. As Jazz kind of alluded, it's not just about physicians, it's about dietitians, it's about health counselors, it's about health coaches. And really what we're trying to do is use all modalities to try and help people get the information that they need, but probably most importantly, the inspiration to make the changes. And so one of the things that we're looking at within this platform is that when you get into digital technologies, we've seen how these platforms can change behavior, right? I think we've all probably realized we pick up our phone 70 times a day and we watch our kids using these devices. And we see what Facebook and Twitter has done to our society. We need to take that power and we actually need to use that in a different kind of way to systematize behavior change for positive. And so what we've done is we've essentially taken a strategy that's evidence-based. So we call it the 4+2 diabetes reversal strategy. And there are 12 evidence-based behaviors or habits to learn, and each person's quite different. And we personalize it on the basis of clinical data, comorbidities, what's the person's environment, what are their skills, who are their supports, what are their goals, and try to help them kind of find their path and then stay on that path. And ultimately our goal is to make this as easy, make it, help physicians prescribe lifestyle as easily as they do medications, right? Because I think coming back to the systems part of this, it's the challenge of busy, overworked family doctors that in their few minutes they don't have the time. So we've created it so that physicians can refer to us. We've created the platform that physicians can actually use the platform in their practice if they want to use the tools themselves, or they can work with us. And really what we're trying to do is create system capacity for climbing that cliff. And so, the patients can self-refer to us. We involve the family doctor kind of at every step. We don't take on family medicine or primary care. We simply do the lifestyle prescription. And really what we're looking for are people that believe in this and that want to work alongside of us. So I'll put the link in the chat, and I'd be really happy to talk to anybody that's interested in this and wants to collaborate with us.
Thank you. Thank you, Byron. Our next physician sharing experience will be Dr. Bal Pawa. Dr. Bal Pawa is well known to most of you. She participated in last year's conference. She's a colleague, a friend whose own personal story has led to integrative care. She provides integrative care, runs the integrative care clinic in Vancouver. and is the author of this book of Mind Body Cure, which was our choice book last year. And as I said, we'll be giving out 2 copies later. So with that, Bal, over to you.
You're on mute, Bal. Good morning and thank you. I'm a curious person by nature and I learn something new every day. So thank you for your thoughts. Aaron wanted me to share my story as well as, I see the people in the trenches. I work in the trenches. I've treated thousands of women over the past 21 years, but how did I land here? And I was a very busy general practitioner. I was doing a lot of deliveries many years ago and had a very successful practice, busy, super mom, 2 kids and 1 on the way. I did a delivery for somebody. It was a difficult delivery. And as I was driving home, I was literally hit by a truck. And I suffered a lot of injuries physically. And of course, the PTSD of losing a child and going through the accident. In those 7 years, I learned what was missing in our intervention model. We have a fabulous intervention model. I couldn't have survived if they didn't extricate me from the car, or when I had a collapsed lung, I needed a chest tube. So we need intervention, of course. But what was missing was looking at the integrative approach to healing, and how I discovered it serendipitously is that I couldn't do deliveries anymore because my shoulder was injured so badly with fractures. And I went to Harvard Medical School to learn about mind-body medicine. Little did I know at that time that that would have been the most transformative decision, not just personally, but professionally. And I had the good fortune to meet with a cardiologist who was on the cutting edge. And we were talking about evidence-based medicine. He was looking at how does our thought, the language of our mind is our thoughts, the language of our body, our feelings, and how is it that our thoughts can change our feelings? And he looked at our nervous system, and our nervous system is like an engine. We call it the autonomic nervous system, and it has a brakes and a gas. And through his research, he taught me that if you upregulate the parasympathetic nervous system, you actually change the biochemistry of the body. You produce DHEA, serotonin, endorphins. And being a pharmacist as a background of my medical, I realized that we actually have an internal pharmacy that's built in. But most of us spend our time with the gas on. We're producing adrenaline and cortisol. And when these hormones of inflammation and stress are on all the time, and you have excessive amounts, it's going to do damage to your system. And we have this beautiful body that works as a unit. So our mind, our body, our gut, our immune system. Immune system is an extension of our nervous system. So I began to delve into the research. I've attended so many conferences around the world. I added to my education from functional medicine, integrative medicine. I studied with Deepak Chopra when he was a nobody. At that time, he was an endocrinologist, and he looked at the neuroendocrine changes that happen when we change our mind. So I really loved what Dr. Nagendra was saying, that we have to look at the body as a whole. And when I came back from Harvard, I just couldn't go back to being a family doctor, writing prescriptions, a pill for every ill. And I co-founded the West Coast Women's Clinic with my friend and colleague, Dr. Nishi Dhawan. And since then, our success has been in transforming lives. We've seen thousands of women who come in, and women are the pillars of our community. They're caregivers, they're nurturers. They often work double time. They're working outside the home, they're working inside the home. So they're faced with a larger burden of care. And there are many barriers to women's health as well. And we took a very multi-pronged approach. And as Brenden was saying, lifestyle is very important. But what I find even more important is to create a mindset If you create a mindset, that is going to have sustainable results. You can say to your patient, please go home, walk more, eat less. But I realize the most important decision maker is your mindset. When you wake up, who is making those decisions about food, about movement, about activity, and if you're stressed or not? And so I spend a lot of time with patients through the research I've done, trying to help them to reframe the way they look at their lifestyle factors. And that's been extremely successful. And the outcomes are it speaks for itself, because 75% of the symptoms that present in a doctor's office are largely due to excessive, chronic, prolonged stress hormones. So I feel that the work I'm doing and the doctors I've trained since then have benefited from this experience and knowledge. I teach medical students in first year and second year at the Faculty of Medicine. And I'm extremely excited to hear that there's going to be a new medical school, and they're going to include multidisciplinary integrative thinking and the mind-body connection. And I would love to contribute to that. The ripple effect of treating women with this sort of integrative thinking and the pillars of health, of lifestyle, mindset, exercise, diet, has been profound. So I implore all of you who are in the policy-making seats and lawmakers and health ministers to please invest in prevention and invest in women's health. Thank you.
Thank you, Bal. We could go on. Each one of our speakers can talk for hours, and I'm not doing justice to their stories by only giving them 5 minutes. But I think CIN is a catalyst and a facilitator and a doer, and we are determined to bring this integrative thinking capacity in our system, and today is just a start. So with that, I'm very happy to introduce Dr. Ramneek Dosanjh, another colleague and a friend, current president of Doctors of BC, and another physician who is determined to bring the change and transformative change on integrative thinking. So with that, Dr. Dosanjh, over to you to share your journey for over the next 5 minutes. Thank you.
Good morning, and thank you, everyone. I am coming to all of you from also the ancestral and unceded territory of the Musqueam, Squamish, and the Tsleil-Waututh Nations this morning. And I am so grateful for this opportunity to Dr. Garg and the SINS organizers to allow me to participate in today, and with so many wonderful colleagues that I'm surrounded with on the panel this morning. I just wanted to begin by, again, like Dr. Saluja and Dr. Pawa have given, and Dr. Byrne have given some of their own personal experiences, I too will start with this. My belief is that a holistic integrative healthcare approach addresses the spectrum of physical, mental, and environmental influences that affect each individual's health to provide the most effective solutions. And for me personally, being raised in the Western world, but immersed in Eastern philosophical household, I've noticed that the bridge is what I started to notice, and what I noticed about bridging the Western philosophies or allopathic medicine, as well as integrating Eastern philosophies and the mind-body spiritual connection, which we don't really talk about that much in Western medicine, as well as the way that we're trained. Working in my private practice, I learned that disease and health are so much more than just diagnosing and writing prescriptions. I agree with Dr. Pawa and Dr. Saluja that we do interventions, and they are life-saving, and at the level of the healthcare system as it currently exists here is definitely necessary in order to provide the level of care that we are able to. However, working with marginalized and vulnerable populations, immigrant populations, and many of my patients in the South Asian culture, as well as mental health and substance use populations, I noticed quite early that the healthcare system as it stood was not going to be efficient or in a way that I could really truly deliver care. I felt that my patients required time and integrative health approach, which is not the way our system currently in BC has been built. So my aggravations and frustrations as a provider, pretty quick out of residency and training, I trained in the US and learned that there is a way to actually do holistic integrative healthcare. However, it was hard to find my own niche when I came back here. It wasn't until my own physical challenges, and as Dr. Pawa also alluded to, her own realization through her own personal journey, I've had similar patient journeys. And in 2011, I had a devastating cauda equina, which meant I was paralyzed from my waist down and that I would not be able to practice medicine the way that I had always thought I would. However, I was set out to defy what I'd been told, that I wouldn't be able to walk again. It was during this time and my arduous recovery that I had a thought that I couldn't participate in the system that I also feel at times is contributing to the disease burden. And we needed to do things innovatively. And so that's what led to my own medical leadership career and the need for me to get involved in trying to make transformational system change, which I'm still trying to influence at this point, as are many of my colleagues. But in order to challenge the status quo, we need to challenge thinking. And I think I'm grateful for this opportunity in where we are actually looking at integrative health options, which I do believe that should be embedded in our medical school training and all curriculums, because in order to understand our patients, and if we think about our Indigenous populations or our marginalized and vulnerable populations, we have to think about their whole care. I am still passionate about healthcare reform. And when I think about medicine and health, we are diagnosis and disease driven. But why do we have the disease? As Dr. Saluja also mentioned, is that when are we asking the why? We have to understand and empower patients in their care and give them ownership of their clinical condition. Primary prevention, culture change requires robust participation in the homes and households of many of our patients, and it begins in the community. So we know that the commitment among integrative health practitioners is to keep the client's needs and their stories central and directive to their process of healing and recovery. So I truly believe in shared decision-making, co-created wellness visions at the center of the healing journey. And when you think about health, the first four letters are heal. How far we've come from healing in healthcare. How far have we come from healing in our own healthcare journeys. And I believe that integrative health is built on a foundation of advocacy for multicultural perspectives, cultural sensitivity, social justice, and health equity. So I'm a big believer in social justice and advocating for health equity, because I believe that core values such as fair access, empowered decision-making, client-centered care, and affordability are what is going to help people change. And I think when Dr. Byrne and his program and going after diabetes, one of the biggest chronic disease burdens and obesity in the world, you think about really disrupting the disease itself, but really disrupting the mindset. And what Dr. Saluja has also spoken of is helping our patients get creative and conscious of the contributions that they have and a responsibility to their own healthcare and lifestyle patterns, which I truly believe this is the way forward. So I will just start with that. And I just want to say thank you and grateful for the opportunity for everyone that's participating today. And I'm also looking forward to learning a lot more from all of you. Thank you.
Thank you, Dr. Ramneek Dosanjh. It's so wonderful to have these stories and to lead us into the academic change. Our next participant is Dr. Anurag Saxena, who is the Associate Dean of Postgraduate Training at University of Saskatchewan. He has a special interest in leadership, and I got connected with to him through my colleague, Dr. Graham Dixon, who is on the participants, and we are working together on integrative thinking in leadership. And Dr. Saxena will share some of his thinking around how this capacity can be incorporated in training and in medical schools. So over to you, Dr. Saxena.
Thank you, Dr. Garg, for the opportunity. I am from and in Saskatoon, which is the Treaty 6 and the homeland of the Métis. We reaffirm our relationships with one another. I actually wanted to come at it from a slightly different perspective. I do want to share one of my personal stories in like less than 15 seconds, that I was actually diagnosed with pre-diabetes 15 years ago. I'm lucky that my family doctor actually believed in integrative medicine. This is 15 years ago. And till today, I have not required any medication. So I think, his advice, his consultations, the lifestyle changes people have referred to in the earlier talks, they have been phenomenal. So I'm a living proof that it actually works. I do want to actually, however, emphasize most of the stuff from the leadership perspective and the system changes that Dr. Garg, you had referred to at the beginning, the opening today, when you were mentioning about innovations and transformations. So, well, one of the views of leadership would be, to change the system, to have movement towards a newer place. And with that, I think one of the things the leaders do actually is create conditions for the success of others at different levels in the system. I will actually talk about three specific things. One is the role of education. Second one has to do with practice. And the third one has to do actually with integrative thinking itself. So I will share with you one of the things we have done at the medical school here in Saskatchewan. Most of the time when the students get introduced to medicine, the first year has emphasis on biomedical model of disease and sometimes even biopsychosocial model of disease, which most students and most practitioners do understand. But I feel that one of the leaps we need to make has to do with the biopsychosocial ecologic model of disease, because that then brings into a more holistic view of health. And it's not just about disease prevention, it's actually is about health promotion. So we are doing that to some degree. And I can tell you that there is some resistance to that because the time in the curriculum is limited, but we have to, if we are really going to be talking about healing, we have to revise some of the things we do. The second thing I wanted to talk, which actually bridges education and practice, is the concept of interprofessional education. And most of the time it usually refers to nutrition and physical therapy and dentistry and occupational therapy. But I think there is less time devoted to what could be and what has been traditionally referred to as complementary or alternative medicine. And I think there is some work to be done in that area as well in the medical school curriculum. And this does require really navigating boundaries and territories within the medical school curriculum, which are currently occupied by people who are predominantly, and I speak very frankly, who are predominantly committed to the Western traditional style of medicine. So I think that that's something else we need to do. That would require actually practice of leadership. And I would draw everybody's attention. I think everyone is aware of the LEADS framework of healthcare leadership and medical education leadership. And I think that is going to be a very good strategy for not just personal things you do in the innovation field, but also system changes. Regarding the integrative thinking itself, I think everyone knows that, but I wanted to bring two phrases to the fore. One has to do with, in the light of the physician burnout, is physician heal thyself. So if we are going to be promoting integrative thinking and integrative healthcare for others, we can only teach and co-create with our patients who we are, not what we know. So I think it's extremely important that we truly are practitioners of integrative health ourselves, because then if we are convinced of that, then it's an easier thing to work with our patients in that area. The second thing I wanted to talk to you about is the role of leadership in creating a space for constructive discussions of evidence and opinions related to Western medicine and the complementary/alternative thoughts. I think there's a big need for this, because anytime I have had tried to have these discussions, it does require a lot of work to create a space which is safe for people to speak and which does not succumb itself to the hierarchy of Western medicine. Again, I speak from the systems perspectives here. And the third thing I wanted to very briefly talk a little bit about, I've got only about 15 seconds to leave left here, is how to actually think about integrative thinking itself. So again, we do have courses for our residents on, that was my alarm going, telling me that 5 minutes is forward. Dr. Garg, if I have like 15 more seconds, that'll be great. We do have courses for our students on critical and creative thinking, and we have been developing something on integrative thinking, which takes into account the Western approaches to dialectics. Dialectics could be viewed as a reasonable approach to resolve contradictions. And Peter Drucker, from Harvard School, and then the Rotman School of Business, they put out something. And very recently, Graham Dixon shared an article with us, which was talking about the generative emergence in complexity science. So those kind of things, but then reconciling these with the Indian and the Indian ancient philosophies of thinking, because when you look at from Socrates all the way to Hegel, we talk about how to resolve contradictions through dialogues. But if you look at the ancient Indian philosophies, there really is no problem in simultaneously upholding truths at the same time, the empirical and the transcendental. So I think the challenge would be, how do we teach our students in a manner that they will see relevant to themselves? So I'm going to stop there. Again, thank you for the opportunity.
Thank you. Thank you very much. And friends, as you could start to realize, this is all about you. What we have done is bringing thought leaders for the change and transformation, and CINS is committed to take it further. It's all about integrative thinking, how we think about the problems. And I think this beautiful, beautiful description by 5 of our speakers. Last but not the least is dear colleague, Dr. Hanna Nette, who is the medical director for Inspire Clinic and really dedicated her life to integrative thinking for cancer patients in a very broad way. She'll be sharing the experience and the work of the clinic and her own experience. Thank you. Over to you, Dr. Nette.
Thank you so much for that generous introduction and for the opportunity to be with all of you today. How wonderful to be invited. And I agree with others who've said that they've learned a lot from today's session. So thank you. I am coming to you today from the ancestral and unceded territories of the Coast Salish people on a very special Father's Day. So I'll start with the personal experience. So my training is in family medicine, and I had the opportunity to, after I completed my residency on the East Coast, to start work with an incredible group of family physicians here in Vancouver. And I, after several years of that work, and having a child and trying to make it all fit with delivering babies and palliative care in people's homes and just incredibly meaningful work. I had the experience of having my closest friend and family member, just a couple of years older than me, diagnosed with cancer. And through the experience of trying to be the kind of support person for her that I wanted to be, I discovered online an organization called Inspire Health. Inspire Health Supportive Cancer Care. I found myself there as a support person for my friend and family member. And it really opened my eyes to a whole other side to our healthcare system. And even though I had been practicing almost a decade at that point, I couldn't believe all of the parts of not just our disease model, which many have said, we do an amazing job at acute care, but the illness experience and all that goes with it. And what it opened my eyes to was that somebody as healthy as my as my friend, as my family member, could get cancer. And the fact that through her experience with Inspire Health and I'm going to tell you more about that soon, and with shifting some things in her life and addressing some chronic health issues that she didn't even know she had, she found her way to a new level of health through a cancer journey. This is what we see every day at Inspire Health. People describing that although they came to us with cancer, they are leaving with better health than they've experienced in their adult life. This is transformational. This is incredible. Inspire Health Supportive Cancer Care was founded 25 years ago by two medical doctors who had a vision to better fill the gaps in the cancer journey for people. So to be able to integrate lifestyle support, mind-body support, connecting people with meaning and purpose and value in their lives through their cancer journey, to augment the support that they're getting from the cancer care treatment system, and to transform their lives. And this is what we see. We see people describe that they have a different level of health and wellness coming out of a cancer experience. How do we do this at Inspire Health? So 25 years ago, I actually appreciate that it probably started more like 30 plus years ago. These physicians petitioned the government in British Columbia to support this vision. And they received funding from the government to build a model of integrative cancer care. They were able, with an expansion of this funding in 2011, to expand the team of people to support patients with cancer, from physicians, which is what it had been until that point, to include dietitians, counselors, exercise therapists, coaches, and to be able to provide these services free of charge for people. That came with an opening of doors that we have seen to be able to break down some of those barriers to access for cancer care, both for patients and loved ones. So there's no cost to these services. People can come and receive individual support, one-on-one, that can be over the telephone, in person, or virtual. And people can access classes, group classes and programs, and build community. So those programs can look like exercise classes. And of course, in the last 2+ years, that's been living rooms across British Columbia and beyond, exercising to music and connecting with community. That can be upwards of 100+ people in many of these classes, nutrition classes, and then an array of self-care and self-awareness building workshops that people can access. Meditation, yoga, qigong. Many of the measures that we see, the evidence is out there that this makes a big difference in people's lives. So these are empowering tools and practices that people can take into their lives and that make a difference, and we see the difference that it makes every day. So thank you for the opportunity to be here with all of you. I look forward to the further discussion.
Thank you. Thank you very much for each one of you. What a beautiful setup. Just to share with the audience, our idea is that CINS will be facilitating a post-conference roundtable. We're very fortunate to have leaders from various institutes and practitioners in the audience. So this is not just an exercise of an academic workshop, but really is how do we bring this capacity in what you have heard. So for over the next 5 minutes, maybe any of the panel discussions want to bring out anything else, or they want to share anything with our participants. So it's 10:13 for
Did
next
you want
5
me to
minutes.
jump in? Did you
Yeah,
want me to
okay,
jump in
yeah.
here, Dr. Garg? Was that where you wanted me to come in?
Yeah, yeah, go ahead, Minnie, but before we get the chat line, if there, I was just giving panel members if they wanted to add anything to what they have already said. If not, then Minnie, take over from the chat line, and then we have 10 minutes for that. And then Dr. Ganguly will be doing the summary.
Yeah. So I've been reading through people's comments and things, and I think it comes back to a comment that I heard kind of yesterday was, and building off of what you said, Dr. Garg, you know, we're preaching to the choir here. All of these are really great, great concepts. But one of the things I'm just going to draw on is what I'm hearing a lot from the speakers is their transition in their practice actually came from their personal experiences. And that actually, it wasn't necessarily how they were trained in school. So I think it's so exciting having Dr. Saxena here with us today from the university and bringing the perspective from a leadership perspective, because we have great things that are happening, and people that know me know I'm a great advocate for the patient's voice. And in a lot of today's conversations, it's the patient voice. You happen to be a physician that's able to take your experience and apply it into your practice. I actually have a couple of questions, but our scientific coach here for yesterday's session, Lisa Dawson, also has a couple of comments that she wanted to make. So I'm just going to hand it over to Lisa for a second for her comments. Go ahead, Lisa.
Thanks,
It
Benny.
looks like she's driving in her car.
I did pull over. No, I want to thank everybody on this panel, and I have a lot of love and respect for all of you, and I've been very impressed by my interactions with many of you over the last while. I wanted to add a comment that's both personal and professional about sleep, because you all mentioned sleep, and I will say in my professional life, managing a cancer survivorship clinic, which manages very young women with early menopause, I think the one thing, the signal that has been crystal clear for these ladies is if we can really help them with sleep hygiene and work on all the other elements that give them a good, restful, restorative sleep, the quality of life and lifestyle and weight and exercise and everything else will be able to follow. That's the professional comment. The personal comment is that I actually trained in obstetrics and gynecology and gyne-oncology, and about 12 years ago now was diagnosed with multiple sclerosis, and I'm doing great. But I will say that I, deep in my heart, wonder if that would have happened to me had I not done 1 in 3 call for 7 years. And when I was able to really try to fix my sleep, my multiple sclerosis improved dramatically. So just a little professional and personal vignette about what I've learned on the sleep phase.
I would love to add to that, Minnie. I see a lot of women, and we call MS the busy woman's disease. Women are largely affected by MS, and MS is, you know, we're not sure what causes it. Is it autoimmune? Is it viral? We really don't know. But what we do know is the immune system is inextricably linked to the nervous system. And we do know that when you sleep, you rejuvenate your nervous system, you rejuvenate your immune system. And so sleep is a very big part of it, but stress and all the factors that go into it, it's like a perfect storm. When a woman is diagnosed with MS, she's lacking sleep, she doesn't have energy, she's not eating properly. There are multiple things that are going on, and all of those come together, and then they manifest the illness. So autoimmune disease and women, there's a huge link there, and how stress impacts women's hormones as well.
Yeah, thank you both for that comment. And that kind of leads to a question that I'll put out to the panel, anybody who may want to answer it. And it builds off of that leadership again. When we're talking about integrative thinking and to integrative medicine, and it's bringing in, I'll say broadening the practice of physicians, I'll look at it from the view of administration, because my role has been in administration in healthcare. And what I have seen over the years, we have built onto our administrators, right? They were charge nurses. Then they had to become quality assurance experts. Then they had to become business managers. And we put all of these things into the role, which is contributing to their burnout. So my question to you as physicians is, do you see that there's a risk factor, or what are some things that we can do to mitigate it so that we manage the scope and the expectations of physicians in delivering what potentially could be a broader scope of practice? And I may be wrong in that, so I'm happy to take some of your thoughts on challenging me that's not necessarily a risk as well. So anybody jump in.
Any comments from any of the panel discussions? And also, if there is any summary comments any of the panel members wants to make in addition to what they have already said, before we move on to next summary by Dr. Ganguly and next steps.
Yeah, maybe I'll jump in. I mean, I think one of the things that what we have to really recognize is we're all swimming upstream in our culture, right? So the collective world culture that's emerged with, its frenetic pace, its stress levels, its minimization of sleep, its ultra processed food as being the dominant nutrition form. I mean, in Canada, over 50% of our food supply is ultra processed. And that's ultimately what we're fighting against, right? And so it's a real challenge. And I think for my physician colleagues, what I often see is complete moral distress at the end of a 10-minute visit, trying to re-prescribe 10 or 12 medications for somebody with chronic disease, knowing full well that if they could spend the time and kind of do practice in a different way, that real change could happen. And it wouldn't be from the physician, it would be from the person leading it themselves. But there's not the time to do that, and instead you write the prescription, and you feel like you're part of this machine that's grinding people into poor health. You just have to look at the prevalence of, so I'll go back to type 2 diabetes. Prevalence of type 2 diabetes in 1970 was less than 2%. It's 10% now, and 1 in 3 Canadians have either pre-diabetes or type 2 diabetes. And most of the people who have pre-diabetes don't actually know they have pre-diabetes. So again, this is what we're up against. So I think that the part of the challenge with this is we've got to get the voices out, and I think pursuing kind of leadership opportunities to amplify this message is so important.
Thank you, Dr. Byrne. Any other comments on that topic? Another question that has come up through the chat room is, what are some of your thoughts or suggestions around what policies need to change in order to shift closer towards integrative medicine? I mean, Brenden has touched on one, right? It's the time factor is a big barrier, right? Physicians just not having the time. But go ahead, Dr. Pawa.
I think when we look at prevention models that have existed in other countries, prevention is, and teaching patients, so it's empowerment with knowledge so they make better decisions about their health. It's engaging them, as someone said earlier. But I think having a plan to roll this out and create protocols and standardization and education, how does that happen? So I guess policymakers would have to focus on education and awareness first, and giving physicians a little more support, because what I feel rewarded in is that West Coast Women's Clinic, we have a psychologist, a nutritionist, we have a kinesiologist. So right now, when you look at doctors, they're burning out, they're leaving their practice because they're not supported. But if they were supported with lifestyle, then they could do the work that needs, to be diagnosed or interventionally treated. But right now, doctors are having to work as social workers, psychologists, nutritionists, and they just don't have the resources. So I think resource funding and creating education awareness, and then, teaching practitioners, which lifestyle practitioners, is something that we can roll out without too much cost.
I see Dr. Nette nodding her head on that one. And Dr. Saluja, did you guys want to add anything to that? Because I mean, you guys have kind of achieved that, right? Like to some degree, you guys have at least shifted into that direction.
I think Dr. Dosanjh has raised her hand. I think Dr. Dosanjh.
I'm happy to speak after Dr. Saluja and Dr. Nette if they want to go ahead.
No, Ramneek, please go.
I think about from a policy level, at least from the organization, I represent Doctors of BC, and I think what we have realized is that when you create the gold standard and embed it into your policy, you can actually take that policy. For example, maybe related, unrelated, but we are developing a current gold standard for gender equity and within our membership organization this year, because obviously that's one of the causes I'm pretty passionate about. But I feel like, and we've been talking about women empowerment and women's health, and until we actually make a professional gold standard to move to, that we can actually take to our external stakeholders and accountability, it's really difficult to implement change and to have something that it must change, and we think about rules and regulations. When the College of Physicians and Surgeons creates a guideline of standard professional practice, we must adhere to it or there's consequences. And I know that's in hierarchical fashion, but there's some aspects of that actually could work with framework. Another thing I'll talk about with policy is policies change when there is, like Dr. Pawa said, an increased awareness and consciousness. And I think what we have to remember is the policymakers on the other side, or government or stakeholders, they will respond to our electorals. They will respond to the voters, right? So when you make the cause, such we're seeing in the primary care crisis right now, we're seeing patient advocacy at the grassroots is what is engaging conversations and transformational change, because we have to make it about the people that we're serving. And I really do think that when the patients and the community is engaged and there is an uproar or an ask, it tasks them. It becomes a very urgent ask to the policy change. And I think when we implement the policy, that's when we have the ability to ensure that the care that we provide is that standard. So I do believe in embedding policy change, but I do think that connecting the grassroots and from the front lines into the policymakers is really important.
Thank you for that. And that makes total, total sense, looking at it from a system perspective. I mean, we as a culture in the Western world and probably beyond have gotten used to, the pill for every ill, and we want the quick fix. Where are we at within our culture of people starting to shift? And somebody in the chat box referred to social prescribing, and I know that there's a few initiatives that are happening now where social prescribing is starting to occur here in BC. It's quite popular in the UK and some of the European places. And how might social prescribing start to help to shift us? Because it's still something physical and tangible that patients. So two parts to the question. One is, where do you guys see we're at culturally with people wanting to make that shift? And would social prescribing potentially be a mechanism to support that shift?
I guess I can add a couple comments here. So I think my view might be a little bit skewed because I run a lifestyle medicine specialist clinic, right? And so majority of the patients that are being referred to us, their referring physician has talked to them about, wanting to make some changes. And these are patients that for the large part have agreed to want to go see someone where they can make change. That said, in 5 years, we've crossed 20,000 referrals. And so I just feel like that may be indicative that there is a large number of patients and a large number of people in our communities that are sick of not feeling fantastic, right? And they're starting to say, okay, what else is there? Is there more that we can do here, right? So I do think that there is a large, portion of people that want to have this type of medicine or this type of healthcare in their lives. In terms of social prescribing, I wanted to share a small anecdote with something that's kind of carried with me, the power of groups in healing, right? In our clinic, we started doing group medical visits back in 2018 as a way of helping patients just bring power of group together and really just facilitating discussion. And it was really fun for all of us physicians because we really didn't have to do much in terms of the teaching. It was really just facilitating discussion. It was beautiful to see one person come up with a situation that they're running into their life, and having another patient kind of say, well, I went through that like a few months ago, and this is how I dealt with it, right? So I was following up with one of my patients about a year into treatment, and she was telling me that that their group visits had actually run its course, and what they ended up doing after the official group medical visits had finished, the group of women actually stayed together, and they actually met in a park throughout the summer once a week. And she told me that in the group there was this one lady who recently had just lost her job. She was a single mother of two, and this could have been a moment that could have been pivotal in terms of her trying to get more of the ultra processed food, because that's actually more affordable and whatnot, right? The other members of the group actually took it upon themselves to actually cook meals and to drop them to that patient's house while she was just transitioning and finding a new job, and she actually was able to get back on her feet. And obviously this is not something that's a sustainable, like a systems-wide change, but it just shows you that like health isn't, I think someone put in the chat group, we think about health and we think about patient and physician, but we can think about health and like patient and communities, educators. When you talk about policy, I think it's not always necessarily just about the health, like the Ministry of Health policies, but it's coming up with policies where health is actually being saturated in all policies, whether it's in education, whether it's in recreation, whether it's in city planning, right? Those type of things. And the other thing, sorry, one last thing with policy is that I do think what we fund as Canadians really shows actually what we think is important. And I get this feedback sometimes saying that lifestyle medicine is something that is available for people that are privileged because you can afford to buy good food, you can afford to go to the gym. And that's absolutely true in the current state. That's exactly true. What we need to really we need to kind of push, governments and policymakers is to actually fund. If someone needs healthy food and they can't afford it, it should be covered just like their statins covered. Mm-hmm. If someone needs, we have, Ozempic is a medication that everyone's, really excited about, and all these medications. If we can pay $6,000 a year for someone's PCSK9 inhibitor, we should be able to pay for their clinical counseling, their time spent with, and get other things like that, right? So for me, when there's a lack of funding, it just shows like there's a lack of belief that it works.
Thank you for that, Dr. Saluja, and not for today, because I think it's a big topic, but I'd love to have the discussion expanding on that and talking about the potential movement towards a pharmaceutical program for the country as well. But we'll keep that topic for another day.
Minnie, we have time for one last comment, and I noticed Brenden has raised his hand.
Yes.
Yeah, I just wanted to echo what Jazz just said about the power of group visits. And I have to say, as a physician, before I started doing these, I didn't get it, and it took a while to get it. And it's exactly in these subtle interactions that go on of people supporting each other. And so it's something that we have the mechanism for. So there's a lot of things that we can criticize the system and say that there's no mechanism to do this. We actually have the mechanism to do it. And it's really a powerful thing that we can kind of unleash, and we can do it in a whole bunch of areas that we're just not even touching, right? So kind of all of these things could actually be, help people to, first have the knowledge, but then figure out kind of what they need to do in their own lives to start to do these things. So there's no better teacher than somebody else who's walking down the same path as a person.
Thanks. Thanks, Minnie. Thanks, everyone. Thanks, the panelists. What a wonderful discussion. And I know we didn't do justice to your stories, but please stay with us. We're not going to let you go. CINS is well known. Once it's had its collaborators, they never leave us. So there will be follow-up. Minnie, do you have any final words to say?
I will draw attention to, in the chat box, Catherine Robson. She's under the name of Jessie Downey. She's asked a question. So if I could draw our speaker to that, they may be able to answer her question there. I also received a direct message that somebody said, listening to our panelists, I feel hopeful for the future of our healthcare system. And I thought that was a really nice summary of everybody's comments that they've brought forward today. That when we see that the public feels hopeful, I think that's very inspiring. If I can have like just one more minute, Dr. Garg, if I could just ask each of our speakers in their own 2 or 3 words only, their final thoughts that they want to share with people.
They could put on chat box. I think they could put in chat box as well. Some words they think of.
Yeah, maybe there's, okay. So if you wouldn't mind just putting in like a couple of words, just like that person shared with me, I feel hopeful. So if you have a few thoughts like that, please share it into our chat box. Dr. Garg is keeping me on time.
Good, thank you.
All right, thank you all very much. That was a great discussion.
Thank you. I think I do want to point out among our participants is a very good friend and colleague, Dr. Jivasu, also known as Dr. Pradeep Kumar, and he has shared some comments. And I know I won't do justice by asking him to speak right now, but do want to bring him in our roundtable follow-up. But Dr. Jivasu, do you want to say anything before I ask Dr. Ganguly to do the summary?
Yes, what I wanted to say, what we call integrative medicine, a holistic approach is not true holistic, because still it is based on Western models. It is not really truly integrating Eastern ideas, because Eastern ideas start with self-knowledge. But what we are trying to put together is to bring technology or yoga or meditation or different modalities, because there are symptoms. So we want to deal with the symptoms, because the fundamental core of East Indian knowledge is self-knowledge. Do I understand my mind and body? Because once I understand my personality or dosha, as Ayurveda called, then I can integrate anything. So what we are trying to create is a mosaic. Pieces together, they look like whole, but there is no organic unity. There is nothing to fully integrate. So that is what I wanted to, that is why I was pointing it out. It's truly integrative, or it is the old approach, but in new form, but nothing fundamentally radically changed inside.
Thank you. Thank you, Dr. Jivasu. Definitely, we are going to be thinking in terms of transformative changes in British Columbia. We have some unique opportunities with new medical school, with new health center coming, and in the participants, some leading policies. Thank you very much, and we will follow that up. With that, then maybe I could ask Dr. Ganguly, our co-chair from New Delhi. Time is past 11:30 now. Dr. Ganguly, do you have any summary comments?
Thank you, Dr. Garg. It was very rich. Everyone was a modern medicine doctor, and with their life's experiences, they changed and created systems which ultimately benefited their patient groups in a big way. So that's what was which came out of that. There were some common themes that there was social support, the lack of social support. There were a lot of community engagements and lack of policies which were needed. And we got some very good solutions for that. I will explain Anna Fletcher, the Vice President of Puerto Rico's one of the famous triangles, where she said that and nothing goes whether the knowledge or a product goes to people if the people don't make a demand. And that happens to the social and behavioral scientists and others who engage the communities. So this actually came up, the groups, forming the groups, creating, as Dr. Saxena said, that creating space for discussions with the divergent viewpoints, so that ultimately people can understand the system much better. So these were this is one common theme which actually went through. The other common theme which went through was equity and in the system, as well as some need for health system reform, which at this given moment in most of the countries for integrative medicine are not there. They are not part of the health system. So this was also talked about by everyone. But the theme came up in the chat box and other discussions. So and one of the things which came up was Dr. Saluja's experience of his father, that although he recovered from stroke, he got a cardiac event. So here again, I bring out a Canadian work of Salim Yusuf, where in the pure study, he showed the 4 serving of vegetables and the cut fruits, as well as appropriate exercise and meditation, can really bring a lot of changes. And he also created a group of medicines which reduced the 60% thing. So what Dr. Saluja said was true. And Dr. Saxena got out pre-disease. Dr. Byrne also got out pre-disease. The pre-disease is many times done with food. There are even Abbott gives a food, 2 food preparations, one for diabetes and one for lipid lowering. So pre-disease was again a theme which was over there. Dr. Dosanjh brought in a very important part, that she deals with the migrants, and migrants come with many of their own cultures. And if you accommodate them, their cultural thoughts and others, you can do better. And Dr. Brendan's digital thinking was something which was very, very interesting, that it actually, then you can reach masses, actually large number of people for discussions and interactions, whereas their engagement becomes very, very strong in the system. Dr. Pawa gave a solution for her parasympathetic stimulation of endorphins and others, that breathe. And this actually, when you are under stress, take deep breaths, relax your muscles. So she gave some solutions also. It was not just something which was in the air. The leadership part was brought out by Dr. Anurag in a very strong fashion. And this leadership space actually provides a real big stimulus for creating discussions, creating thinking, leading into policies. So his leadership theme was very important. And last one was Hanna Nette's comment on the cancers. This is one of the very major miseries, and people who can be motivated and who can be given integrative systems for counseling, for diets, for lifestyle and others, they can perhaps fight if they have a chance. And this is something which has been shown in one of the Boston symposiums where I attended, where a person with his lung removed had fought three cancers, but climbed the Mount Everest. So these are all possible. This was very, very rich, and I'm very gratified that I was a part. I heard these discussions. Only one thing, the sleep was talked about much, but the main thing was because I'm 81-year-old, I can't sleep. But I can relax, and I have never been to a hospital, never taken any treatment. I hate medicines. I'm an allopathic doctor, but avoid medicines. But then the sleep, the main theme is that how you manage stress and how you could relax and be happy. If you are happy, then you have won the battle. Thank you very much.
Thank you, Dr. Ganguly, for those wonderful words. And friends, we are coming to close to our session. I just want to share with you that this is action-oriented exercise, and CINS take great pride in being catalyst, being a facilitator, and being a collaborator. So our plan is to follow this up with a roundtable discussion of the key policymakers, key academics, and build this capacity in integrative thinking in the broadest sense, not just a buffet system, but really truly a fundamental change how we think about health. And very fortunate, I'm delighted with the support certainly CINS has received from all these groups. And we hope after today that we will build on that, because if you look at our history for last 12 years, we take one topic at a time and bring to fruition, whether it was establishment of South Asian Health Institute in Fraser Health, whether it was advising Government of India on allied health, whether it was LEADS program for leadership, whether it was lowering the burden of chronic disease or diabetes through engagement. And now we have taken on the challenge of integrative thinking, and we're going to follow this up. So thank you very much.